Now, for the complication of fracture, we need to know that the complication of fracture generally are simple. Complications of fracture are divided into different ones. You are going to have immediate complications of fracture, we have early complications of fracture, and we have late complications of fracture. Generally, that's how we divide complications of fracture. For the immediate complication of fracture, and each of them I'm going to explain what occurs in them. For immediate complication of fracture, you have neurovascular damage. If you want to have more marks, you can just say nerve damage and vascular damage. And you need to know the specific nerve and the specific artery that is located to the side which is being fractured in order for you to have the best marks. If you speak about a humeral shaft fracture, generally the nerve that is associated there is a radial nerve. So the side that is mostly affected is a radial nerve palsy. Is it clear? So those are the things that you have to know. The vessel, which is in the case of a distal humeral fracture, is a case of the brachial artery. Is it clear? And we have also the brachial vein, particularly the nerve located at the level of distal humerus, the ulnar nerve. So you should know for ulnar nerve palsy, the risk of ulnar nerve palsy when you have a distal humeral fracture. Those are elements that you have to know. Now, also in immediate, you can have organ injuries, particularly in the level of pelvic fractures. And I've forgotten also to tell you that when you have pelvic fractures, the specific classification here is TIES classification. Basically, specific classification for pelvic fracture is TIES classification. Now, for the organs, when you have a pelvic fracture example, it can result to organ damage, injury to the pelvis, pelvic organ injuries. Example, the bladder can get injured. The urethra particularly is usually get injured in pelvic fractures. That's when you have a pelvic fracture. Generally, we don't do urethral and transurethral catheterization because you are afraid of a urethral trauma. Are you getting? So those are the different elements you have to put in mind. So you can have an organ injury, or that you can have even the uterine injury, a vaginal injury in the case of female, or a penile injury, a scrotal injury still occurring in the case of a pelvic fracture. Now, after that, you have to speak about early complication. Early complication, particularly infections. Don't say that the patient having a closed fracture is going to have infection. No. Is it clear? It is infection generally occur in patients that are going to have what? They generally have there's a communication with the environment. Is it clear? That's where you can speak about infection. And this is in the case of an open fracture. When you have an open fracture, you have communication with the environment and it can get infected. Also, you have a case of a basal skull fracture. In a basal skull fracture, you need to give antibiotics. Why? Because in basal skull fracture, there's communication with the normal flora, is it clear, which is located in the respiratory tract, is it clear? And when there's that communication with normal flora, there are the risk of causing a meningitis and infections. That's why you have to give also prophylactic antibiotic in those cases. The second case after the infection, we have now pulmonary embolism from thromboembolism. Is it clear? You can have what is called thromboembolism, which occurs, is it clear, from which is also pulmonary embolism. And this is because of an increase in mobilization. When you have an increase in mobilization, what happens is that there's the clotting process can be started. Is it clear? When you have an increase in mobilization, clotting process can start. Are you getting? When you have an increase of mobilization, clotting process can start. And when clotting process start, you're going to have now dislocation from the deep veins of the calf of the lower limbs into the pulmonary circulation, resulting into pulmonary embolism of thromboembolism etiology. Is it clear? Now, the third element is that why is it that pulmonary embolism generally occur in adults and in children? Pulmonary embolism of thromboembolism etiology occur more in adults and children. Why? Because the clotting process, fibrinolysis, occur faster in children than in adults. So when there is clotting in children, declotting occur very fast. Is it clear? So children do not usually suffer too much of clotting disorders. Is it clear? Of excessive coagulation disorders. Is it clear? It's only in cases where there is a proved case of a thromboembolism that they are placed on anticoagulant therapy. Now, the next stage after pulmonary embolism, of thromboembolism etiology. You have also fat embolism. Fat embolism is also another important aspect, and you have to know that still fat embolism occur more in adults than children. And why is that fat embolism occur more in adults than children? Occur more in adults than children because the bone marrow of adult is getting what is called involution. We're going to have a process of involution that occurs in the bone marrow of adults. And when you have involution, the bone marrow is becoming more of adipose tissues as the process of the aging is continuing. Is it clear? So we are going to have more of fat at the level of the bone marrow of adults and children. So when there is fracture, those greasy substances can get now embolized to the lungs and cause another form of pulmonary embolism, but of fatty origin. The next complication are the late complication, and the late complication consists of one, you have non-union. So what is non-union? Non-union is defined as when the time of bone healing, when bone healing is more than 2 times the normal time of bone healing. Is it clear? When bone healing occur more than 2 times the normal time of bone healing is said to be non-union. Now let's understand now what is the normal timing of bone healing. That is what you have to understand. What is the normal timing of bone healing? You need to know that there are different normal timing of bone healing. The timing of bone healing in adults, so let's take in the case of adults. In adults, bone healing take for the upper limb, it is going to be 6 weeks in order to completely heal, and for the lower limb, it's going to take completely 12 weeks in order to completely heal. That is upper limb, that is lower limb. That is for adults. Upper limb, lower limb, it takes 6 weeks to completely heal for upper limb and 12 weeks to completely heal for lower limbs in adults. Is it clear? Now